The EndoSequence system utilizes procedure packs. The expediter file, along with radiographs, is used to help determine the procedure pack for the given case. We have small, medium, and large procedure packs for small, medium, and large canals. If the expediter file protrudes into the canal and reaches engagement in the apical 1/2 of the cutting flutes, then you have a small procedure pack or a small canal. If 3/4 of the cutting flutes are loaded with debris, it's a medium canal or a medium procedure pack. And if all of the flutes are loaded with debris, you have a large procedure pack. As with all rotary file systems, you should first establish patency with a small hand file. Then you take the expediter file into the canal, and based on where it loads with debris, that tells you whether or not you have a small, medium, or large procedure pack. In this case, we have a medium procedure pack because 2/3 of the cutting flutes were loaded with debris. Moving into a medium procedure pack with a crown down motion, we have a size 40-04, and the progression is 1 back, 2 back, 3 back, very gentle strokes. The EndoSequence file is very efficient. And you do 2 passes of 3 engagements. So here we're with the size 35, 1 back, 2 back, 3 back, clean the file, come back in, same size 35, 1 back, 2 back, and 3 back, and we're done, and we clean the file, and we move down to the next smallest file, which is the size 30. 1 back, 2 back, 3 back, and you can see I've basically reached working length at this point, just confirming that I have the working length and there's no need to do any additional shaping. I take my size 30-04 paper point, confirm that I have my length, dry the canal as I normally would. Take the size 30-04 BC bioceramic coated point. These cones are stiffer than normal points, and you can see that the cone gives you a very nice tug back. And next I will be coating the master file used, the last file used in the canal. I use a clean file. I coat it with sealer. This is EndoSequence BC sealer. It's a bioceramic sealer. 0 shrinkage. It actually bonds to dentin through the formation of hydroxyapatite. You also get a bond between the BC sealer and the BC points. This is a room temperature technique which I'm showing here. To deliver the sealer into the canal, taking the last rotary file, I'm going to coat the flutes with the last rotary file used, and then I'm going to deliver that down to the apex, and then slowly twist it in a counterclockwise fashion to sufficiently coat the entire canal. You could also use a small hand file or even a gutta percha point, simply trying to deliver the sealer along the canal walls. And the importance of using something to deliver it along the canal walls rather than just syringing it in is that it's always good to pop any bubble that there may be due to hydrostatic pressure or hydraulic pressure in the canal. You can see here I've reached my full working length. I do coat the cone again prior to placing it to length, so I know that I have plenty of sealer in the canal. And this is the EndoSequence system.